Imagine this. You've just stocked your fridge with fresh, juicy blueberries, ready to sprinkle them into your morning oatmeal or blend them into a smoothie. But what if I told you that these tiny, nutrient-packed berries could be dangerous if you're on certain medications? As healthy as blueberries are, they can interact with specific medications in ways you might never expect. In this video, we'll explore the hidden risks of eating blueberries while on certain meds, and we'll dive into real-life cases that might just make you rethink your daily berry intake. Stick around till the end, where I'll share how you can safely enjoy blueberries without compromising your health. Number 1. Blood thinners and blueberries. Blood thinners like Warfarin are prescribed to prevent blood clots, but they require careful monitoring of your vitamin K intake. Here's where blueberries come in. A study published in the American Journal of Clinical Nutrition highlights that blueberries, though not as rich in vitamin K as other foods, still contain enough to potentially interfere with blood thinners, leading to a risk of clotting issues. Take the case of John, a 65-year-old man who loved his blueberry-packed smoothies. After a few weeks, he noticed unusual bruising, and after a checkup, his doctor found that his INR levels, which measure blood clotting, were off. The culprit? The blueberries in his diet. Once he adjusted his intake, his levels stabilized. If you're on blood thinners, you don't have to give up blueberries completely, but it's crucial to maintain a consistent intake of vitamin K. Talk to your doctor about how much is safe for you. Number 2. Diabetes medications and blueberries. Next up, let's talk about diabetes medications like insulin and metformin. Blueberries have a moderate glycemic index and can lower blood sugar levels, which might sound great unless you're already on medication to control your glucose. According to research published in the Journal of Nutrition, blueberries can enhance insulin sensitivity and lower blood sugar. However, combining them with diabetes medications can sometimes lead to hypoglycemia, dangerously low blood sugar. Consider Sarah, a 58-year-old diabetic who enjoyed a blueberry snack every afternoon. Despite her medication, she started experiencing dizziness and confusion, classic signs of hypoglycemia. After reducing her blueberry consumption and monitoring her blood sugar more closely, she was able to avoid these dangerous dips. If you have diabetes and love blueberries, monitor your blood sugar levels closely and consult your doctor to see if you need to adjust your medication. Number 3. Antibiotics and blueberries. Now, let's dive into the interaction between blueberries and antibiotics, particularly ciprofloxacin. Blueberries contain compounds that can inhibit the enzyme CYP3A4, which is crucial for metabolizing certain medications. A study in the Journal of Clinical Pharmacology revealed that foods high in flavonoids, like blueberries, can inhibit this enzyme, potentially leading to higher levels of the drug in your system. Mike, a 42-year-old who was prescribed ciprofloxacin for a bacterial infection. He was unaware that his daily blueberry consumption could cause the drug to stay in his system longer, leading to nausea and increased side effects. After his doctor advised him to avoid blueberries during the course of the antibiotic, his symptoms improved. If you're on antibiotics like ciprofloxacin, it might be best to skip the blueberries until your treatment is complete. Number 4. Chemotherapy and blueberries. Some studies suggest that the antioxidants in blueberries could potentially interfere with the oxidative stress chemotherapy drugs create to kill cancer cells. Research published in Cancer Research indicates that while antioxidants are beneficial, they might reduce the effectiveness of certain chemotherapy drugs by neutralizing the free radicals these drugs rely on to kill cancer cells. Take Emma, a 50-year-old cancer patient who incorporated blueberries into her diet for their antioxidant benefits. Unfortunately, her oncologist noticed a slower-than-expected response to her treatment. After removing blueberries from her diet, her treatment efficacy improved. If you're undergoing chemotherapy, it's critical to discuss your diet with your oncologist, as even healthy foods like blueberries might need to be limited. Number 5. Calcium channel blockers and blueberries. Calcium channel blockers, such as verapamil and diltiazem, which are used to treat high blood pressure and heart conditions. Like with grapefruit, blueberries can interact with these drugs by inhibiting the CYP3A enzyme, leading to higher drug levels in your system. A study in the Journal of Cardiovascular Pharmacology found that consuming foods like blueberries that inhibit CYP3A can increase the concentration of calcium channel blockers, leading to side effects like dizziness or low blood pressure. Rachel, a 70-year-old with high blood pressure, started experiencing fainting spells after incorporating blueberries into her diet. Her doctor identified the interaction with her medication as the cause and advised her to limit her blueberry intake. If you're on calcium channel blockers, be cautious with your blueberry consumption and discuss it with your healthcare provider. Now that we've explored the risks, you might be wondering, is there a safe way to enjoy blueberries while on medication? Moderation is key. Enjoy blueberries in moderation and try to keep your intake consistent if you're on medications that might interact. Timing matters. If you're concerned about interactions, consider timing your blueberry consumption to be several hours apart from your medication. Consult your doctor. Always talk to your healthcare provider about your diet, especially when starting a new medication or if you're unsure about potential interactions. Before you go, let's address a common misconception. Many people believe that because blueberries are natural and healthy, they can't possibly interfere with medication. But as we've seen, even the healthiest foods can have unintended consequences when mixed with certain drugs. And here's something many people don't know. Blueberries, despite their potential interactions, are actually one of the best fruits for overall brain health due to their high levels of antioxidants, particularly anthocyanins. So, while you need to be cautious about how and when you eat them, they can still be a fantastic addition to your diet when consumed correctly. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe. See you in the next video.